Hi, for those that you're doing your best to try to manage your neuropathy and you definitely don't want to get any worse, stick around, watch this video because it's only going to be a couple minutes long and I'm going to share some really important news with you. I'm going to give you a great offer. I'm going to share also some detrimental medical research about a couple things that you really need to know when you have neuropathy. Now, furthermore, I was prompted to want to shoot this video for you and give you this special offer based on an evaluation I just did in the clinic. I just saw a patient that I've worked with off and on through the years. For whatever reason, there was a long time lapse between now and his last evaluation. Not good for the patient. And this is preventable. This is why I want to tell you some key points so I can try to help you keep from the scenario of getting worse. First off, neuropathy is always progressive. Okay, there are three things that I'm going to tell you that are going to be really, really important just for you to manage. Number one, you need a TCS test. This is the most widely used test in the clinical trials, the medical studies. This is the most widely used test that I can find on neuropathy. Okay, and I'm going to read some of the research on that so you don't just have to take my word for it. It's a very reliable test. You need it done, you need it twice a year. Second thing is you need to have your blood work analyzed for how each thing on there, each thing called a biomarker or just abbreviated as marker, you need to see how each thing on there, each marker, directly or indirectly affects your nerves or your nerve function. Make sure you have the best environment for your nerves to heal. You don't have to be perfect. You just have to be, I'm just giving you some awareness. This is real. You get blood work done already anyway. Why not have it analyzed to make sure that you're not, doing adverse effects to your nerves on something that could be easily managed. For example, I just went through a patient lab and saw an anemia. Anemia means you can't get oxygen to important tissues. For our discussion, we'll just leave it at that. But it was something that was treatable, and now they can be treated for it and not have anemia, so they can get oxygen to. So number one was the test. Number two is a lab analysis for how it relates to your nerves. Number three is do the home activities. If you've been to the NerveFit program, we would have given you activities that were based on what we saw you responding the best to here. So make sure you're doing those home neurologic activities. So I just saw a patient in the clinic that had atrophy in the lower leg. So the muscles in the calves are really starting to shrink up, more so than we had seen in the past. That is a huge red flag, especially when it's happening rapidly. Okay, so that you need to, only half the people with neuropathy have pain. Half of you don't have any pain. Okay, so you can't, but even the ones that do have pain, most of them are taking medicine so you don't feel as much of the pain, which is, I understand that's logical, no judgment implied there. The point is you can't base how things feel. That does not equate to how good or bad it is. Okay, so I'm going to show you how to do that. So home activities, make sure you're doing them. If you haven't done them in a while, it may be tough. They may not be able to do enough for you. I'm just being upfront. So anyone that wants this evaluation, it's $140. I'm going to give it to you complimentary. I think it's the next 4 days, so that they're looking at time on our schedule. I'm doing this on purpose. You need this done twice a year. But even if you only had it done once a year, you will be able to use this test to compare to your last test, just to see if you're getting worse or if you're actually staying the same. Or you say, well, I know I'm getting worse. Well, how much? Are you at risk for amputations? Because listen to what I'm going to tell you next. Okay? So, or just how are you right now? Even if you didn't have it in the past, you want to know how are you right now? It's something you need to know. So go back to the test with me for a minute. So you need the TCS test. Here's what the medical research shows on it. So I saw a patient in the clinic and he had atrophy in his lower leg and his toes are starting to drop, also called claw toes or getting claw foot. He's getting deformities in his foot from his neuropathy. Don't forget those nerves that you have damaged. Those nerves supply the muscles, tendons, and joints, among other structures. And you get changes in your feet, not good, because when you have structural changes in your feet, you'll start to put pressure on your skin, parts of your skin, like the tops of his toes will start rubbing, Or the hammer toe, same thing. On the outside, you put pressure on the skin in your feet where it's not supposed to be or didn't used to be. And the skin starts to erode, becomes very thin. And you break the skin, a lot of people don't even feel it. And you're at risk for infections. Infections lead to amputations when you have neuropathy, So you get an ulcer that won't heal. So I'm not trying to scare, it's scary. There's just under 100,000 amputations every year from neuropathy. So circulation, of course, that's important. But I'm talking about you have to have good nerve supply for tissues to heal. Okay, so this is just really important to have a TCS test done every year. Here's a couple medical studies. Here's what they say. This is from the Diabetic Medicine Journal. Reliability and validity of the TCS in polyneuropathy. They go on to say the TCS has sufficient reliability and validity for use in clinical research. Not just clinical practice, actual research. It's good enough, it's accurate enough to use in research. Here's a Journal of Neurology. The TCS is valid for a wide spectrum of polyneuropathies. The scale also showed excellent reliability and accuracy. Conclusion, the TCS is valid and reliable scale for a wide spectrum of polyneuropathy. Poly just means a lot of nerves. Mononeuropathy, polyneuropathy, mono is one, poly is a lot. Don't get caught up on that. Sensory neuropathy, polyneuropathy, peripheral neuropathy, it's all neuropathy. It just means nerve damage, same thing. I don't want to get hung up on that. So TCS is valid and reliable scale for a wide spectrum of neuropathies. Might be useful in clinical practice and research for the diagnosis and staging of neuropathy. What stage, mild, moderate, severe, how bad you are. How bad is it? It will tell you that. Whether you've had it done in the past or not, you need to know this. Diabetes Care Journal, validation of TCS for neuropathy. Conclusion, TCS is a valid instrument to reflect the presence and severity of neuropathy. Last one. This is from NIH, National Institutes of Health, which is our U.S. National Library of Medicine, our government compiled or funded research at clinicaltrials.gov, which, by the way, coincidence, as I'm recording this, what I'm citing right now from this government trial on neuropathy is a 13-month trial. They used the TCS test for the neuropathy trial. It just wrapped up 2 days ago, 48 hours ago, as I'm recording this. Sensory polyneuropathy is one of the most prevalent neurologic disorders. To diagnose sensory neuropathy in clinical practice, a relatively easy and inexpensive method is needed, and it names the TCS. Get the TCS. These scores would enable physicians to diagnose polyneuropathy in a reliable way without the need of additional examinations. We know at Missouri Pain Treatment Center, people with neuropathy, you're not getting the help that you need. We believe everyone deserves help so you can lead a more active and better evaluation. I'm giving it away for a very limited time to a limited few that respond to this in a timely manner, totally free, complimentary, no strings attached. Why? Because you need it. You need it. So to refresh, I'll go over your lab analysis that you've already had done as it relates to nerves, direct or indirect causes. I will recap any necessary home activities that are applicable to your case. And I will also do the TCS test for you so you know where you are right now. Or if you've had it in the past, you can look if you're getting worse or not. No charge. Very limited time. You want to respond to this so you can get a spot. 1-855-FIX-FEET. That's 1-855-FIX-FEET. Dr. Ryan K. Lewis, DC. Take care. Bye.